Third question, are more people aware of being healthy by diet, exercise, and the like, rather than pills and surgery? That's a good question too, because most of the time, if you take a pill for one thing, the side effect one of the top 3 side effects are usually the very thing that you're taking the pill for. So if you're taking a pill for low back pain, one of the top 3 side effects is going to be rebound back pain. And it's hard to get away from that stuff. And so when you change and you start eating healthier, you start exercising, it's just, we all know you start feeling better by going that route, especially with pills. Sometimes surgery is a necessary thing. People have their knees replaced or their hips replaced, and all of a sudden they say they're walking better than they've walked in years. We prefer to go about it and try to prevent it from ever having to happen that way. But if it has to happen that way, again, we're in the United States, it's crisis care. Let's go ahead and get it changed, and then from that point on, just because you've got a replaced knee or a replaced hip or something like that, that doesn't stop you from exercising then. It should make it easier for you to exercise because you're not going to wear it out now, right? Fourth question. So someone finally decides to come to the chiropractor. What do you look for when a patient first comes? Oh my gosh, there are so many things that we do. We have, like anywhere else you go, there are a ton of questions that you have to answer. And part of that is to release me from having to ask all those questions again. I'm able to take a look at all these questions that we ask about your family history, about you, about your history, about your slip, falls, and slam dunks, what you're eating, what you're not eating, what you're drinking, what you're not drinking, what type of exercise you're doing, what have you done to try to help it feel better, what have you done that has made it feel worse, when does it feel better? All these, all the why, what, where's, when's, and how's. I come in and then start asking questions. We start trying to find if we can find a common link that links how you feel and how you perform to how well you're actually doing. Because remember, how you feel is not a real good indicator as to how well you're actually doing. I'm sure we've all known someone that had cancer that didn't know that they had cancer until they were almost eaten up with it and they were pronounced with 6 months left to live. Or what about a cavity? Do you always know you have a cavity? Most people, we go to the dentist every 6 months or so to have the dentist tell us whether you've got a cavity or not. So we start diving into those types of things. After we've done as much talking as we can to figure out, at least get a preliminary what's going on, then we take you next door and we start with these scans. Because remember, your brain controls everything in your body. Every single cell, tissue, system, and the coordination of all of that is controlled by your brain. And we are self-healing. It's not the Band-Aids and the Neosporin that heals a scratch, right? Your skin heals inside out. We're also self-regulating. You walk outside, you come back inside, your body temperature stays about the same. It's not, we're able to take care of ourselves that way. You don't think about making your liver, right? Your liver just livers on its own. So that's healing and regulating. And if your brain is controlling all of that, it's got to communicate one way or another. And it communicates through your nerves. And if your nerves are being interfered with, then your brain is not going to be able to communicate as well as it should with your body. And the job that we have next is to go in and do scans to check out 2 different types of nerves and then look at your muscles. After that, I start poking and prying, seeing if it feels better if I do this or if it feels worse if I do that. Can you do this? Can you not do that? We do all those things, and then we determine whether we need to actually take x-rays or not. And if we need to take x-rays, we take those. That way we can actually see what you look like on the inside, see how you compare structurally to functionally. And then we're able to put that together and know whether what I do, what chiropractic does, is going to help or not, or if you need to go somewhere else and get something handled first.